This is Focus on Your Health. It's brought to you by Kingman Regional Medical Center in historic Kingman, Arizona. I'm T.G. Lafredo, and this week on the program, I'm coming to you from KRMC's Hualapai campus. My guest is Patrick Gummow. He's just finishing his pharmacy residency, and he'll be talking with us about how specialty pharmacies help people and communities. Patrick, welcome to the program.
Thank you for having me today.
I'm glad to speak with you. We got to talk a little bit in the past. You've been doing some presentations. We will be talking about how specialty pharmacies help people and communities. Interesting topic. First, if it's okay with you, a little bit of getting to know you.
Yeah, for sure.
Tell me about your career thus far in medicine. What led you into pharmacy?
Yeah, so I actually wanted to know I want to be a pharmacist for quite a long time. So I wanted to be a pharmacist since about the age of 12. I'm 31 now for reference, so quite a bit of time working towards it. Just throughout career days in middle school and high school, it really solidified my decision to go into pharmacy. Looking into it, it allows you to have a pretty good work-life balance while being able to provide a decent amount of money for support a family on. And so that's kind of what got my initial pursuit. And then as I looked more into it, I really liked the aspect of you're in the healthcare system, you're able to help people, but yet you don't have to necessarily deal with the things that doctors have to do or nurses. You're a little bit more held back from like the physical exam side of things where I don't have to deal with blood and things like that.
Yeah. Were you always drawn to science and chemistry?
Yeah, for the most part, I would say so. I really like to read and learn, and so developing more of the science and chemistry aspects of things was definitely one of my decisions to go into pharmacy and just like how the body works. In pharmacy, it's more what we call the pathophysiology, and that's more about how the body's working within itself as far as how the different cells are interacting with each other and the different receptors within the body interact with different chemical messengers, and that's more of how the pharmacy side of things work. The drugs are acting as chemical messengers for your body, which modifies how your body responds.
Yeah. You know, I've been interviewing pharmacy residents now for some time, and I think years ago I had the idea that pharmacists were sort of working in a box. We didn't talk to pharmacists very much, but it's really been impressed upon me over recent years that pharmacists are really involved in patient care. They interact often with patients.
Yeah, so pharmacists are one of the most accessible healthcare providers out there. If you think about it, a lot of grocery stores you go to have a pharmacist available there for a consult, or independent pharmacies may be out there, or pharmacies like CVS. Oftentimes, you can be able to walk up and talk to a pharmacist. Sometimes they're busy and it takes them a minute to be able to have the time to walk over to talk to you. But often you're going to get a quick consultation to them, and they're able to give you a quick reference of something to be concerned about, whether or not you should see your doctor, or if you need to go to the emergency room sometimes even.
Yeah. The pharmacy residency is an option for you, but it's not required as far as I know. Is that correct?
Correct.
What was it that made you decide that that would be the next best step in your career?
So for me, it was when I was a pharmacy student. I was on a rotation, and for me, while I was in school, you learn a lot. A lot of the times they describe it as drinking from a fire hose in pharmacy school, where you're just getting lots of knowledge, and you have exams very often. And while you're able to learn a lot that way, for me, when I was actually applying it on my different rotations is what really helped solidify the concepts for me and be able to connect the dots between like how the different therapies work together and the different disease states or different health conditions patients have in order to provide the best treatment possible. In pharmacy school, a lot of the times you learn about what's like the most ideal or perfect treatment, and then you get into the real world and you're like, oh, this may not be able to apply due to what's available in the area or patient's finances or what their insurance is going to be able to cover. And so for me, I really wanted to push my knowledge and be able to really apply the things I've learned in school and have it solidified through the different practical experiences. Residency often says you're able to get 3 years of experience in 1 year. And so I really wanted that extra training before I moved on in my career.
Is that what you found?
Yeah, I honestly have. They definitely push you a lot in residency. You're doing what we call topic discussions with your different preceptors or kind of your mentor while you're on a rotation, and where they just go into depth about different disease states, and you're able to really gain a lot of knowledge, solidify some of the stuff you have learned in pharmacy school. And then as you move forward, you're able to apply it to actual patients and be able to see the effect it has on patients' care.
And what brought you to KRMC in particular?
So in particular, I have a friend who is an emergency medicine physician resident here. He told me about this hospital and how it was a small place, and I had even though it's small, they provide a high level of care. And it was in the middle of Arizona, a little bit more rural. And for me, it sounded a lot nicer as well because I grew up in southern Utah, and it's very similar to my home community as far as population and environment goes.
Yep. I know as a pharmacist you have to be good at a lot of things, but I also know that most pharmacists have an area or two that's of particular interest. Do you have something that matters especially to you?
Yeah, for me, I'm leaning more into what's called informatics. And so what that is about how healthcare providers are interacting with the electronic health record, where all the patient's history, medications are stored, along with how the doctors are going to be putting orders for the medications while in the hospital or while going out in the outpatient status to their pharmacy. And just about how that can make an impact on how easy the doctor's life is, and as well as making sure there's a standardized level of care throughout the organization.
Well, because you mentioned technology, I'm legally obliged to ask you about AI in medicine. How do you see the future? How do you see the present? How do you see the future?
So AI in medicine, I feel like, is definitely going to be a part of it. Right now, one of the main sources is being used is in being able to summarize patient-level visits with providers. So not everywhere is doing this, but some facilities are integrating where when you go to see the doctor, they'll have their phone out with or a recording device where the AI will listen in on the conversation, what was said, and they'll summarize and write the doctor's note for them, which just makes their doctor's life a little bit easier, maybe a little bit more accurate of a record, making sure everything was talked about. And then the other way it's currently being used is being able to summarize information in a patient's chart quickly. That way providers don't have to read through dozens of notes in order to obtain the information. They can get a quick summary of the patient's health history and some previous visits and what has occurred.
And the future.
And for the future, I feel like going forward, the best way it's going to be being applied is going through and continuing with those summarization skills, and then as well as just helping cut down on the time providers are going to be doing things such as prior authorizations, which is when the insurance require a bit more information before they'll pay for a medication, just to make sure that it's a safe and effective treatment. So just being able to really save time for healthcare providers, and then as well as helping providers make some decisions on some potentially more complicated disease states where the AI is able to summarize a lot of information quickly for them. The providers are still going to need to have that clinical knowledge or rely on what they went to school for to know whether or not it's an informed decision, because AI does have some problems in making sure that it's accurate information. Sometimes it will cause hallucination, where it gets confused and will think it has a correct answer when it's not really.
Which could be scary in a medical context.
Yes.
So we need actual humans to do that work, right?
Yes. At this point, we need actual humans there to verify that the AI is correct.
I hope we'll need actual humans for a while to come. I'm not quite ready to cede all control over to the machines.
I agree. I feel like AI is going to be a great aid in helping doctors make informed decisions, as well as progressing patient care, even allowing patients to get more information themselves. But really, as humans, we need that human aspect involved in it. AI is really great at making logical and calculated decisions, but it's not so great at the common sense or applying what's going to be best in the scenario in the real world.
Yeah, those are great points. I don't know if it sounds a little cheesy, but I'll just tell you, this is one of my favorite days of the year, talking to the pharmacy residents, because I always learn something, but also it's really inspiring to me to have a few minutes to chat with people who are just launching into their careers, and it's an exciting time.
Thank you. For me, I'm really excited too, as I continue to progress in my career.
Yeah.
So I am currently wrapping up this first year of residency, and we'll be moving on to doing a second year in informatics. And so I'm really looking forward to that.
That will be here, or that will be somewhere else?
That will be in Nashville, Tennessee. I will be at Vanderbilt University accomplishing that.
Oh, good for you.
Thank you.
Don't forget us, okay?
I won't.
We'll still be here, so come back and visit us sometime.
Yeah, I'll have to try. It is quite the long drive.
If you're just joining us, this is Focus on Your Health. I'm TG Lafredo, and this week on the program, I'm speaking with Patrick Gummow, PharmD. He's just finishing his pharmacy residency here at KRMC, and it's time to get down to business, so we'll talk about how specialty pharmacies help people and communities. So Patrick, let's start with the obvious question. What is a specialty pharmacy?
So specialty pharmacies focus more in serious or long-term health conditions for patients that often require a higher level of monitoring and care for these patients. A lot of the times that these medications require special handling as well. They just need a little bit more attention with them. These medications are often expensive, and so you want to make sure the patient's getting the care that they need and the medication is not going to go to waste, just to reduce the cost of healthcare for everyone involved. And then as well as oftentimes they're providing more support than a regular pharmacy. They have a lot more patient contact and a lot of more time spending with the patient to make sure the therapy is safe and effective.
Generally, pharmacies have all kinds of medications and all kinds of know-how. Why are specialty pharmacies needed?
Yeah, that's because a lot of the newer medications coming out are considered these specialty medications. There's a lot of standardized care that are safe and effective that are currently in place that a lot of people can use to treat their different health conditions. But these specialty medications often are filling a gap where people have tried that standard level of care and they need something else to help control their chronic health condition or some other serious health conditions. And so a lot of these medications are a little bit more difficult to use. A lot of them are more of an injection or an IV infusion, and so they need a little bit more guidance. The injections themselves vary from manufacturer to manufacturer. Even sometimes within the same drug produced by the manufacturer, they often have several ways you can administer it. So a lot of times there's extra teaching, follow-up before monitoring to make sure the medication's being safe and effective, and just providing additional support to these patients on them.
So talk a little bit more about what makes these specialty pharmacies different.
Yeah, so these specialty pharmacies are a little bit different just because of the amount of support they're really providing the patients. So I had the opportunity to work as a pharmacy student on a rotation at a specialty pharmacy, and it's just really impressive about how the pharmacy technicians there and the pharmacists are just very well educated in the different disease states and medications and the different programs to help people get these medications approved and paid for. A lot of the time, since these medications are after patients already tried the well-established first and effective lines of therapy that are more affordable, then they move on to these more expensive medications that have also shown safety and efficacy, but require a little bit more monitoring. So these patients are able to be walked through by the specialty pharmacy with about getting the prior authorization. And so the pharmacy is really good at coordinating with the doctor and the health insurance in order to help those out, as well as they spend a little bit more time with the patients as far as going over how to administer the medications. Some of the injectable medications are a simple syringe. Other times that they have a device they actually will stick on the person and will infuse the medication as it goes throughout it. And so really what makes these specialty pharmacies different is that they have these staff that are well trained in these different disease states that allow them to be able to provide a higher level of care, as well as they have more of the time to do so. A lot of the times, when you go to a regular pharmacy, some of the long amount of time you do, unfortunately, spend in the line to pick up the medication.
For sure.
Whereas these specialty pharmacies will oftentimes, when patients are first getting started on the medication, will spend up to 30 minutes often at least just talking to a patient about the medication, side effects, things to watch out for, as well as how to give the medication. And then as they move forward, they do a really good job checking in to make sure the medication's being effective and the patient's having an improvement in their health.
And because those providers are so accustomed to dealing with those particular drugs, they're in a better position to spot side effects, I would imagine.
Yes, and so they're able to know what side effects to watch out for. And oftentimes they have a lot of good connections and are able to know other people where if they may have a little gap in that knowledge, they're able to reach out and get some more information or be able to rely on the manufacturers to be able to get some more side effect information. For example, sometimes there's side effects that are listed underneath the drug, and patients may be like, oh, well, what's the actual incidence rate or how often does that really occur? in other words. And they're able to contact the manufacturer and get some more of the actual numbers out there. And oftentimes, right, something may sound scary as a side effect, but occurs in less than like 1% of patients. So the odds of someone really having it are very low.
You mentioned that specialty pharmacies can help with costs and coordination, and that goes beyond just prior authorization.
Yes. And so a lot of these drug manufacturers have special programs out there where they'll work with your insurance in order to help you cover the cost and the difference what the insurance pays and help you get your medication down to a lower cost. And oftentimes they can get it so what is called your copay, or what you actually pay at the pharmacy, you can get down to zero. They also have programs they can help out with if you're uninsured with the insurance programs, or if you do have more of a government-sponsored health program, they're often able to work with the drug manufacturers on programs particular to those, where they're able to help you work out getting the cost reduced for those.
How do specialty pharmacies help in the community?
Yeah, so for the community, this really helping reduce the load on the providers and the hospitals in the area. Oftentimes in more of these rural communities, providers are not as easy to get a hold of just because we are a bit more rural and providers aren't as spread around the city. And so by having specialty pharmacies, you're able to help transfer some of that load over to the pharmacy as far as the monitoring of medications go, and really helping patients establish well control of their different health conditions they're working with. For example, for some like irritable bowel disease, which can consist of like Crohn's disease, or ulcerative colitis, which is an inflammation often leading to diarrhea in a lot of patients. If the specialty pharmacy is able to help get that under control, it makes so the patient doesn't need to go to see their doctors often. They're less likely to end up in the hospital for a flare-up where the disease is really running rampant and they need some extra help with control with that. And so really it helps reduce the cost of healthcare for everyone involved. And these specialty pharmacies do a really good job at helping patients get these medications, and even in rural areas. They know how to package the medications and oftentimes can have them delivered right to the patient's door, even in these smaller towns or in an area where the patient lives more rural and it may be hard for the patient to get in town to get the deliveries.
Talk about special certifications for these pharmacies.
Yeah, so there's special certifications out there for these different pharmacies. So what these certifications do is they allow greater access to medications that are considered a specialty medication to these pharmacies. Additionally, they prove that the pharmacy is being safe, it's trusted, and it produces high quality care. Keep in mind, these certifications are something that pharmacies are earning. And so oftentimes when pharmacies are first getting started, they don't have the data there for these accrediting bodies to show that they're doing all these things. But I've had the opportunity to work in one of these pharmacies that was considered specialty. We didn't have these accreditations though, but it was still very much the pharmacist is revealing lab values, making sure that the patient's being safe and effective on these medications, whereas oftentimes pharmacists don't have access to that kind of information. So these specialty pharmacies, the certification just adds a little bit extra level of care and just showing that the pharmacy is being safe, effective, they're doing a good job at the clinical evaluation, they're able to get the medications out to the patients safely and effectively. And then a lot of these pharmacies are, as well as working on getting these certifications. So the certifications are a good indication that the pharmacy is someplace you'd want to go to. But keep in mind that oftentimes that even if the pharmacies don't have these certifications, they're able to still provide a higher level of care that most pharmacies are unable to.
Do we have specialty pharmacies here in this community?
Currently, our KRMC pharmacy does have access to specialty medications, and so we're able to help patients out with those. And we're currently looking to expand that in order to provide more care to patients and make sure they're getting the care they need. Additionally, a lot of these specialty pharmacies are mail order, and so some in the areas such as Walgreens are able to fill that role a little bit more remotely.
I know that we have the disease management clinic. I don't know if that's the pharmacy team runs that, right? Is that more of a clinic or more of a pharmacy, or are we sort of debating semantics there?
So that's a great question. So that is more of a clinic. So they are able to operate on something called a collaborative practice agreement, where doctors and the pharmacist both sign a contract together that allows the pharmacist to help manage some of the different disease states that in behalf of the doctors. It just allows the doctors to focus more time on getting more patients seen, making sure they're able to apply all their duties, and then the pharmacists are often more equipped with their knowledge to help patients that are a little bit more difficult to manage on the different disease states. Pharmacists are more of the drug experts, so they're able to help more with the management of if you need anticoagulation for like atrial fibrillation, or if you just have a history of clots and need to be on it for a long term, or with something like diabetes, where pharmacists know are more familiar with the different medications and which ones work best together to help people get their blood sugars underneath control.
We are way off our list of bullet points, and so you pass. Well done.
So, yes. And so the pharmacy itself, with the specialty pharmacy, would be more of our pharmacy that's located next to our hospital here. Mm-hmm. And so they're able to help provide some of the medications that the disease managed clinic pharmacist will be prescribing, such as for hepatitis C.
So take hepatitis C, for example, right? Just say you have a patient who has that. How would that patient determine, I can take care of this at a regular pharmacy versus, I should seek out a specialty pharmacy for this?
A lot of the times it boils down to access. Mm-hmm. So pharmacies, normally these medications are very expensive, and so pharmacies don't necessarily want to order them, whereas the specialty pharmacies, since they're dealing with these patients more regularly, will have the medication in stock. As well as why they want to seek these pharmacies out is just because they are going to get that more of that follow-up and that higher level of care, where the pharmacy is going to be working with the doctor or the provider prescribing the medication, making sure the monitoring is being done, and making sure that the patient's getting the medication so the patient can receive the care they need. For example, the hepatitis C is one of those disease states that can be cured. And so as long as the patient's able to take the medication for the full course, it's something that they can be done with and move on with their life.
Yeah. You mentioned some of these medications require more management, and they have more financial hurdles to jump through. And it occurs to me that pharmacists in this capacity, they're kind of also playing a social work role.
They are a lot of the time. So pharmacy, a lot of the times people think pharmacists are just behind the counter counting pills and just, looking at the pills and like, yep, that's the right pill, and moving on with their life. And But oftentimes pharmacists play a huge role in other aspects as well. The social aspect's quite large as well, making sure that patients are able to afford their medication, being able to take them. I know from my previous experience, I used to work at a home infusion pharmacy as well, where oftentimes we would make sure that patients had a place to get their medications. Those medications often had to be refrigerated. So the pharmacist would often have to work with the patient to make sure they had a refrigerator. And there's even some times where the pharmacy was able to get patients a refrigerator if they didn't have one currently.
Yeah. It's so much more than like when you were a kid and you're like, I'm going to be a pharmacist when I grow up, right? You don't think about having to help people find refrigerators.
Exactly. And so that's one thing I really love about pharmacy is a lot of the times people just think you as a pill counter, but there's just so much more you can be involved with. The way I kind of view it is you get into the career and you just see there's so many different opportunities for you to go that really with a pharmacy degree, there's a lot of different pathways you can go. People often don't even think about pharmacists in the hospital, where the pharmacist is still reviewing the doctor's orders, making sure they're safe and effective. So that's one of what drew me to pharmacy as well, and it continues to excite me about it, is there's just so much to learn about healthcare and the different aspects, because there's really almost an unlimited way you can go with a degree.
Well, Patrick, we've talked about some of the conditions that might require a specialty pharmacy. What are some of the medications that might fall under this?
Yeah, so a lot of the times these medications are considered a biologic medication. These are a little bit more complicated in how they're produced compared to a regular medication. So a lot of the pills that people take are called a small molecule, which is just like a small chemical structure that interacts with the body. These biologic medications are these long chains of what are called peptides in the body that bind to these different sites. And so a lot of these medications you might see advertisements for on the TV. There's things like Skyrizi, Humira, Entyvio. are some examples of these biologics, but then there's still some other small molecule drugs out there, such as Xeljanz. And really what these 4 medications are doing is helping reduce inflammation to treat chronic disease states in different ways. And so even though that they're all accomplishing the same goal, they have a different means in how they interact within the body itself. With these medications, they do a really good job at treating inflammation. One of my favorite ones is Entyvio, just the way it works within the body. And so this is a really safe and effective drug. And for this one example, the pharmacist is going to go through some screening questions with you. They're going to make sure you don't have a currently active infection, just because when you are currently sick, these medications can oftentimes make the medication worse, or the infection worse, because they do make your immune system a little bit weaker. And so they'll want to make sure you got immunizations done as well. And as well, they'll go through the risks and the benefits with the medications really well with you. Then they'll talk about how the medication is stored and how it's handled. And so they'll go through and make sure if it needs to be kept in the fridge, they'll let hey, when you receive this, make sure you put it in the fridge. Talk about how long it is outside of the fridge, and then how to administer the medication as well. And then as well as they'll make sure that everything's set up for your financial assistance, making sure that if you have the commercial insurance or insurance through your employer, that you're able to have it approved with the prior authorization, and then work with the drug manufacturer and see what kind of coupon or discount they can get you. And then they just really a really good job making sure you're adherent with the medication. They'll oftentimes actually call the patient first before the refill is due to make sure that the medication is being given on time, rather than waiting for the patient to call into the pharmacy or come into the pharmacy to get it refilled.
Well, Patrick, I think we've given a good overview of specialty pharmacies. In the moment that we have left, give us those take-home points, would you please?
Yeah. So really, specialty pharmacies are able to provide support to patients with the complex conditions that regular pharmacies often don't have the time for. They spend a lot more time providing closer monitoring and personalized care to these patients as they're looking through lab values with the patients, making sure that the medication's being safe and that they're receiving some kind of benefit from it. Oftentimes, pharmacies are able to get a certification so to help sure that they're providing safe and high quality care. And if they don't have these certifications, they're still providing these high levels of care and are often on the way to obtain these certifications. And then they're really helping improve the patient outcomes as the patients are able to afford these medications and take them on a regular basis, and helping reduce the healthcare costs for everyone involved as the patient's able to live more of a regular life and not have to deal with some of the side effects of having their health conditions. A lot of times the patients are able to go on and live like a regular life and not have to deal with as much of the pain from like arthritis or any kind of flare-ups from their disease.
That is Patrick Gummow. He is just completing his pharmacy residency here at KRMC. Patrick, thanks so much for your time today and talking a little bit about your background, and we'll see you on Music Row.
Awesome. Thank you so much. Have a great day.
And that is the program. That's another edition of Focus on Your Health. I'm TG Lafredo, and thank you for listening. We'll catch you next time.